Hello to everyone. Welcome to my YouTube channel. And I hope you're all doing great there. Today I will be painting about COVID-19 corona vaccine, and I will also talk about the very important information about COVID-19, guys. So we all know that um, lots of countries now are buying COVID-19 corona vaccine, and also here in Europe, the there's also a new variant that are spreading and making outbreak. So it's very important to know whether you will have this COVID-19 vaccine. Um, is it safe? How safe it is? So, well, I will talk about that information. I would like to I will do like that and change the view. I'm not so sure if it's correct. So, or that. It's not so sure. For a while or landscape. Okay. I'm still checking our camera, making sure it's in the correct angle. Okay. So guys, um, uh, here in Belgium, they're already giving us so many information about corona vaccine. You can ask your doctor, or you can check the website for more information. We all know that all of the countries are really um, trying their best to have this corona vaccine for all the people, but sadly saying, not um, as of now, there's not enough corona vaccine to vaccinate the whole population, guys. So it's like a competition. So here in Belgium, they are giving first priority to those who are belonging to the vulnerable group, the weakest group in our society. And we all know that there are so many people, or so many old people, who died because of corona. During the first, especially during the first wave of corona, so many died. So uh, it's like a trial and error management of the whole problem. So it's not easy to solve, especially even to those first world countries where I am right now. And sadly saying, so many are the victims of corona around the world. There are already millions of people died. So we all know that because of this pandemic, our big pharmaceuticals company are really working hard to produce the vaccine for the people. And there are many things that you need to know about the corona vaccine. So I would like to give you some information about that while I'll be doing some painting. In profession, I'm also a nurse. So how does a vaccine work? And why should I get vaccinated? So why should you let yourself vaccinated? So I will um, give information or talk about these important topics. So um, okay, so there's the reasons why you should get vaccinated. So there are at least 70 Belgians, or here in Belgium, at least 70% of Belgians should be vaccinated in order to maximize the effectiveness of the vaccine in the population. So imagine Belgium have 11 million um, population. How about the world? So this kind of virus are evolving, mutating, and we have this vaccine that is being um, developed by the pharmaceuticals, and they already reach those studies or those trial experiments that will prove that this is a safe vaccine. So the group immunity means that a sufficiently large group of people has built up resistance to the virus. So we are trying to have a group immunity, guys. And how can we achieve that group immunity? That is through vaccination. And okay. So I will also now starting my painting. Oh, I think this should be like that. Not so sure. So sure. Yes. Okay. Okay. There. So talking about this canvas, guys, I have this small canvas, panel kind, and I make it a primer with a blue acrylic paint. Okay, so I'll be painting a vaccine vial and a syringe. So I'll just, this is my palette. It's kind of messy, but anyway, I use this white and I will mix it with a little black. So, and this small brush. Are you ready to be vaccinated, guys? In the One Sort Centrum or the nursing home here, it's advisable or recommended, highly recommended for all those health workers to be vaccinated. One by one, they will ask you, do you want a vaccination or not? So it's a very crucial step, right? So we will then add this. We will use another brush that is bigger, so we will be faster. So if you use a bigger brush, of course, it would be efficienter. And I'm using a walnut oil to mix. And at the back, the background music is a Beethoven song. So there. And while I'm painting, guys, I would like to share more information about why should you get vaccinated. So in this way, the virus will no longer be able. So if there is a group immunity, guys, the virus will not will no longer be able to spread on a large scale and cause a major epidemic with accompanying lockdown measures. So guys, they're saying that if we will all be vaccinated, there will be a group immunity, and then we will not there will be no more necessary measures like lockdown or closing of restaurant or other establishment. If you can observe, so many countries now are having a mild or full lockdown. For example, our country, until now, the restaurants are not yet open. What else? The hair, beauty salon, barber shop are not yet open. People, especially the men, have very long hair now. And I am the one who's cutting the hair of my husband now because it's not allowed to go out. And what is the big impact of this coronavirus? Of course, economic loss. So many people will be depending on the government providing financial help. So it's a very big challenge for the government. For a while. Speaking of barbershop, I am the dresser now, guys, because I'm the one cutting the hair of my dearest, my ever cutting the hair of my son, my husband. So yeah, I like it. It's fun anyway. But of course, the barbershop can do it better than me. Anyway, go back to what's the impact of COVID in our society, guys, and why we need to be vaccinated. So In this way, the virus will be no longer be able to spread on a large scale and cause major epidemic with accompanying lockdown measures. It will also protect those who cannot be vaccinated, example, pregnant women, cancer patients, in acute treatment, or people with a severe allergic history to vaccines or anaphylactic shock. So, if on the other hand, guys, if people are vaccinated, the virus will continue to spread and group immunity will become very difficult to achieve. So, if on the other hand, if few, so not so many people are vaccinated because people are scared, then still the virus can spread, right? As a result, more people will run the risk of getting infected, and thus that is why the government are really doing their best to give to encourage people not to be afraid of the vaccine. Okay. Okay. So the sooner we raise the level of vaccination, the sooner measures can be relaxed. So this is what they're promising, guys. So yeah, we are hoping that after being vaccinated, there will be a group immunity. We are hoping, guys. I have the impression that this virus, guys, are really mutating very fast and spreading very fast. Seems we're just, or the big pharma are just trying to discover ways or to make a vaccine, and then another kind of virus are developing, right? Isn't it already tiring to be in this kind of situation where when you go to vacation, after some time you need to be in quarantine because you have to, otherwise you will put people at risk if you're being infected. So there, going back to my painting, and I will use this brush number 10. So it's a glass. I'm trying to make a reflection of it. So guys, those who is not yet doesn't subscribe yet to my channel, please don't forget to subscribe. according to their website, guys, here, the sooner we raise the level of vaccination, the sooner measures can be relaxed. And after all, persons who are infected but vaccinated will be able to infect fewer other people. So, that's according to their studies. However, this does not mean that everything will go back to normal again immediately. That's what they said, guys. So, yeah, do we really expect that it will go back to normal as soon as we're some people are vaccinated? Yeah, according to the government's website, no. So, of course, at the start of the vaccination campaign, that is since last year, measures can only be relaxed gradually. So, cannot expect, we should not expect. Okay. So guys, after that, I will add more white using this. So measures can only be relaxed gradually, guys. Even with the vaccination campaign or the vaccination already being started by batch, they're doing first those people in the nursing homes. And according to them, because not everyone can be vaccinated at the same time. It's true. And we also have to consider that all of those countries are really like competing to have this vaccine. Some of those countries, like in my country, they'll be just starting by February, Philippines, while here they're already started last December, and so far there's not so much reports or negative reports about this vaccination or some reactions. But in different phases, according to the government, they will provide or do the vaccination. And so as long as a lot of people can still get infected, there is a source of risk of new waves, and so the measures still have to be completed with. So we know now that the variant, the British COVID variant, already landed in our country, and there are so many reports about schools being closed because they have some outbreak. So what we need to do, we have to adapt. We need to be watchful, and we all know that here in Belgium the kids are still going to school. It would be difficult for them to study at the home in the first wave. That's already been done, but working at home and caring for the kids, going combination and everything is really difficult. But in some countries, like in my country, they're doing a modular online study, and I don't know if it's efficient enough, if it's good enough. Are the students getting enough knowledge doing this manner? It's all part of like an experiment. Is online schooling really efficient or not? Who knows, right? But of course, the classical way of going to school, listening to the teacher at school, is of course more interesting for the students. So here, children are still going to school, and they're wearing masks, of course, but they're not obliged if they're younger than 12 years old. But we need to check now because of the new evolution of the COVID. It will be in my country, they are wearing, of course, masks, but every country have different approach of how they combat the coronavirus. Just fix the camera since it's not charging. Thank you so much for those who are watching this video. So I was talking about vaccination. What should you know about corona vaccine? So according to the website, this is a website from the government. We are striving for group immunity via the vaccine, step by step. Even then, it is good to be aware that there is always a risk of local flare-ups. So, sad to say, guys, even though there will be a vaccine, um, it's the government is saying that it's not totally a guarantee that it will not happen again. But it's we should be positive that with vaccination, it will somehow put back to the normal life where we can go on some trips freely without really thinking of being infected or infecting people or our loved ones. Here, I need to make a balance on this side. Seems not so balanced. There. I want to add color white here, but it's still wet, so we cannot really do so much. This is alla crema. That's the negative side of oil paint. You need to wait until you can add up the layer. Sometimes it will take you like 1 week for this to dry. But some of the impressionistic artists, guys, they just go out and bring their canvas and paint outside. So it's also possible, right? Okay, guys. So going back to our topic, what you should know about corona vaccine. So moreover, guys, an information about the infection with COVID-19 is not risk-free for young. So there are many informations given to the public that said that if if you are young and healthy, you cannot be infected. No, it's not. So even the young people, even the healthy people, you he can be infected with COVID vaccine, COVID virus. And we have seen healthy people also getting seriously ill from the virus and suffering long-term consequences such as lung damage. And guys, I have one I know one schoolmate before, sadly saying, but he passed away because of coronavirus during the first wave. And yeah, it's really very confronting in happenings that even the young, he's still young, he's like 34. And then how come, right? Working as a ER nurse. Who would thought that even working in UK, there during the first wave, there's a breakage or shortage of the personal protective equipment. And of course, you don't really know yet what's about this disease, right? That's the sad thing about it. You don't know yet. But yeah, we have no choice. As a health provider, you have no choice but to do your work, to care. Okay, then I will paint the syringe. Are you scared of injections? Yes, of course. It's not. It will be painful, but not too. Yeah, you can manage the pain, of course. So all COVID-19 vaccines work more or less the same way in theory, but there are major differences in how they are formulated. So we all know that there are many big pharmaceuticals from different countries who are really making different kinds, or yeah, different brands of vaccine. So the one thing in common, they all train the immune system. So there, it's for the immune systems. What vaccines against COVID-19 are available today? So it is important that no vaccine will be administered here in Europe that does not first pass the control of the European Medicines Agency. So this is the agency, guys, that have the power to say yes, that's already safe. You can give it to the public. They are responsible for this vaccination campaign, and they will make sure that it's safe for the public. It passed the trial. There are enough volunteers or people who undergo the trials for these vaccines. And according to the information, the European Medicines Agency carries out very strict controls on all medicinal products administered in Europe. So if you will be able to come here in Europe, guys, there is really a big difference on in terms of buying medicines in the pharmacy, unlike in the Philippines where I come from. They are more strict. There are medicines that are not allowed to be sold in the pharmacy. There should be a prescription. So that's how it is here. Every country have different ways of administering their medications. And also, guys, um, this agency carries out very strict controls, and they also have a strict control or checkings of the vaccines. Its strict controls focus on the safety of the vaccine, so its efficacy, does it really work, and on its quality. So here, I believe that they will not release those vaccines if it's not thoroughly checked. And to think that the people in the nursing home and the health sectors, nurses, doctors, caregivers, volunteers, job students, health workers, they will get that, then I believe they are thoroughly studied. Okay. So will COVID-19 vaccination be compulsory, guys? No. Like most vaccines in our country, vaccination against COVID will be completely voluntary, and vaccination will be free of charge in Belgium. So it's free if you want to be vaccinated, guys. So it's a very big investment of the government. Imagine 11 million people, if they will vaccinate, if they said yes, I will, then yeah, they will do it. So the available vaccines are Moderna, AstraZeneca, Oxford, and of course the Pfizer. So there's a question that was raised: do I need to be vaccinated against COVID-19 every year? I always say 19 because that's a Dutch word for 19. Oh my gosh. See the shadow of the lights? It's there. Just want to move my Do I need to be vaccinated against COVID-19 every year? According to the information, unfortunately, there is no final answer at present. This is still being investigated. The duration of protection is studied further in the phase 3 studies of vaccinated volunteers and in practice. So guys, it's not yet fully known. We are if you're gonna be vaccinated, then you are partly under the study of the effect about this, how long it will be in your body, is it fully protected for your rest of your life, for the rest of your life or no. So there. So guys, and how many doses will I get of the vaccine? Most of the vaccines that have already been approved, like Pfizer, or that are on the table today for approval by the European Medicine Agency, they involve 2 doses administered with a few weeks in between, 3 weeks. And 3 weeks for the Pfizer vaccine and 4 weeks for the others. So guys, we will be able, if you will decide, then you will have 2 doses, 2 shots. There. So shadows of these vaccines, I need to have black oil paint. This is what I'm using. And another question, do I still need to be vaccinated if I have already had COVID? Some people are COVID positive. It cannot be confirmed today that someone who has already come into contact with COVID-19 is also immune to the disease, and for how long. So, according to the study, it cannot be confirmed. So, all is not sure. there are reports of reinfections. Moreover, it is not feasible to check whether someone has COVID-19 antibodies in their blood and whether or not they should be vaccinated. So, it's still not so clear. They're all doing so much studies, so it's not easy also to decide, guys. Sometimes they are saying that all will be back to normal if you have this vaccine, but then they will be giving you information that it's not yet fully clear. So it's still up to you to decide whether or not. Vaccination is not mandatory, but it does ensure that you protect yourself and others. Vaccines train the immune system of healthy people in case the disease strikes for real or again. Yes. So another question. Where can I find all the details about the efficacy and side effects of vaccine? So as soon as the vaccine is improved by the European Medicines Agency and enters the European market, the information leaflet, so there's already an information leaflet, guys, being distributed. And this is developed for the general public. In the packaging of the vaccine, in addition, there is so-called scientific leaflet. So they are having these leaflets, guys, provided. Intended. So these leaflets are intended, for example, for the doctors, and these doctors who will administer to the common public will also give the vaccination. Who will also give the vaccination will also give you these leaflets, and this has now been done for Pfizer's COVID-19 vaccines, and the Belgian Federal Agency for Medicines and Health Products will publish these leaflets on its website. So there is a website, guys, for in Belgium for all of those informations you want to know. It's on the online website. And of course, here in Belgium, they have 3 languages, and these leaflets or information will also be in 3 languages, of course. So guys, this is the painting. I need a stand. I'm just doing a background here. So there, and then I will sign my signature. And the year. Okay, so that's it, guys. That is my painting for today, and I hope that you were able to to learn something about COVID vaccine, and see you next time for my next video for this oil painting live stream, and we will talk about other things. You can always comment below for any questions or clarifications. Okay, thank you so much for supporting me, and I will end now my live stream, and God bless you. Bye bye.